So the question is which stem to use in which particular case. And for that, first you need to know, because the stem is fitting into your femoral canal, so what type of femoral canal you have, both in primary and in a revision scenario. And that's what we going to discuss. So we all know that to do a total hip replacement, so you need to have a femoral side, you need to have vestibular side, and you have to have bearing, decide the bearing, what bearing you want. So we're covering all this one by one. So we are starting with the femoral side. So on the femoral side, as I said, because the bone can be of different shape and different sizes, and you want to fit a stem which will be not moving, and if it is cemented, then what are the philosophy behind it, and if it is uncemented, then what is the philosophy and what kind of implant you want to have. So the implant, obviously, when you want an implant in cavity like this one, where you got almost normal looking bone, will be very different than in this one, where there's hardly any canal to fit in any stem. So you have to know two things. One, you need to know what is the bone where you want to put a stems, and what are the stem options you have, so that you can match the two and decide which stem to put into which particular bone. So the first thing, first thing is to know where it will fix. So from femoral side, as we discussed last time, you can fix it. You can fix anywhere. You can fix on the head, just resurfacing the head, not cut anything, just resurface the head. You can not cut the neck, so that called neck saving implant, or you can go right into the canal. And traditionally, the traditional stem we use is we chop off the neck and we keep the both trochanter. So just above the lesser trochanter, we cut it, and then we decide which implant will go there, and that's a traditional implant. And normally, Chanley's in his time decided to be about 6 inch long, or about 15 centimeter long, and that's what the standard stems which we're talking about. They are small stems. Nobody knows exact definition of the small stem, but if you want to talk about a normal stem being shortened, then anything less than 120 centimeter is called a short stems. And there can be a different variety of short stem where there is no stem at all in the diaphyseal canal, and we'll discuss that sometime else. But today we're talking about the standard stems where your cut is actually um, right at the this level here. So let me just get the pen. So your cut is here, just above the trochanter. The neck is gone, the head is gone. So it has to fit into the rest of the femur. So that means you have to cut this and understand what is the rest of the femur look like. So rest of the femur could be just like this, which is absolutely normal femur, where you have both greater trochanter, you have lesser trochanter. So this is your GT, this is your lesser trochanter. You have nice medullary, the metaphyseal area, and you have nice diaphyseal area. So this has got no bone loss. This is a primary hip. You can call it a type 0 femur. This is not in the book, just to remember from your part. There's no bone loss, so zero bone loss. So this is type 0 primary hip replacements. And then there are 5, 6 varieties of hip where the loss is of the bone is there in the femoral canal, and you have to then decide which implant you have to do. So you got a primary hip, and then you got where there's a metaphyseal loss. So this is number one. There's a metaphyseal loss. So let me just get the pen here. So this has got metaphyseal loss. The metaphyseal loss could be partial or a complete. So I mean, this could be just a little bit on the top, some metaphyseal loss, or the whole metaphyseal is lost. That is your two varieties of metaphyseal loss, partial or complete. Then there can be metaphyseal plus diaphyseal loss. So here the metaphyseal is also gone. So this is gone. It will not support any stem. The diaphyseal is also gone, and this also has got two varieties. In one, there is a lot of diaphyseal left, and in one, only 4 centimeter left. So that means it is a diaphyseal loss which is partial, but in one variety it is more than 4 centimeter less, and in the second variety less than 4 centimeter left. And then third variety is both metaphyseal and diaphyseal gone. So if one of you just repeat this or revise this for me, any volunteer, Abhipray, you want to say, or anybody else? Abhipray, you want to unmute? What are the type of femur in which you have to put the stem in?
Sure, sir. Good evening, sir. I don't know what's the time zone there. Yeah, it's a morning.
Yeah, it's 8 o'clock in the evening, so that's good.
Good evening, sir. Okay. So, sir, first of all, like you said, like there's no bone loss, so that is grade zero. That is
Yeah,
just
that's the
at the
primary. Yeah, it's not written grade zero, but I've created this.
okay.
Just remember that no bone loss. Yeah.
No bone, yeah. So the
Good.
second one we have is in the diaphyseal region, and it can be partial bone loss about 4
No,
centimeters, or it
second is
can
the
be full.
metaphyseal bone loss.
Metaphyseal bone loss. But it can be partial or complete, like 4 centimeters or more than 4 centimeters.
No,
And
no, no.
then we have
Let's no. Just wait. Let's go
right.
back. Let me just go back. Uh, so the first one was metaphyseal present
Yes, sir.
and diaphyseal present normal.
Right. Yeah.
Okay.
Yep.
So the second variety where is the diaphyseal is absolutely normal. So
Yeah.
this is your diaphyseal, yeah? And
Yes.
there's a controversy. What is diaphyseal? Diaphyseal start, where does it start? Where does metaphyseal end? So let me just get this. So nobody exactly talk about it, but normally if you see the endocortex where it's coming, and when start flaring up, that is the area where we say diaphyseal is almost finished. So let me just go back there. So it's coming, and then at some point it has to flare like this. Yeah.
Okay, sir.
Can you see the endosteal like this?
Yes, sir. It's like a funnel opening up, like in two
Yeah,
parts.
funnel, but for quite